I have chosen to study psychiatry and ISM this year because of my interest in the causes, diagnosis, and treatment of mental illnesses. Psychiatry is often overlooked, even seen as insignificant compared to other medical fields, but mental health is just as important as physical health. The fact that this misconception exists so widely is rather alarming, considering untreated mental health issues can be severely inhibiting to a person's well-being. I'm very excited to be involved in ISM this year for the exact reason described by Abraham Lincoln in this quote. "Things may come to those who wait, but only the things left by those who hustle." This encompasses how important it is to take charge of your own education and future, as I have decided to do. Getting a head start on my career path and gaining professional skills will truly help me fulfill the hustle aspect of this quote and challenge myself to achieve new things. I am grateful for the opportunity to learn about something that I am truly passionate about and become more firm in my decision about my future career path. A great way to learn about the field of mental health care is by researching specific mental disorders, so that is exactly what I did. I won't bore you with all of the disorders that I researched, but I'll hit the highlights of the two that I find the most interesting. First, dissociative identity disorder, or DID, which you've probably heard of as multiple personality disorder. This disorder is defined by the presence of two or more distinct personality states or identities called alters. Patients alternate between these different personalities, which can often be perceived by family and friends of the patient as possession. Typically, a patient will have between 2 to 10 alters, but there have been cases of over 100. Often, a change in alters can be triggered by a stressful situation or a specific emotion. The severe dissociation that comes with DID is often caused by childhood abuse, specifically when there is not a supportive relative to counteract the effects of the abusive relationship. This can cause the patient to split off memories and personality traits into dissociated parts, leading to the emergence of multiple personalities. Prognosis for recovery is fairly positive, however, it typically takes several years. The phases of treatment include mapping the alters, fusing the alters, and consolidating the patient's new personality, which is typically an effective method of treatment that leads to recovery. On the other end of the spectrum is ADHD, the most common mental disorder, affecting between 5 to 10% of children in the United States. Attention deficit hyperactivity disorder is characterized by difficulty sustaining concentration, forgetfulness, and a lack of attention to detail. When diagnosed and treated properly, this condition can be managed very effectively, typically with a combination of medication and therapy. However, it is likely underdiagnosed, especially in females, because of the different ways that the symptoms of ADHD present in girls and boys. While boys often seem restless and distracted, it is more difficult to tell that girls are not focused, as they often daydream or appear spacey. This is a significant issue, as treating ADHD before adulthood is important in order to prevent further issues during adult life. Specifically, girls with untreated ADHD are at a higher risk for having issues with substance abuse and other psychiatric conditions, such as eating disorders later on in life, making early treatment and diagnosis critical. Through primary sources, informational interviews, I was able to gain a better understanding of what psychiatrists do and how diverse the field is. I interviewed Dr. Tayaba in order to gain a better understanding of child psychiatry as a specialty. In the interview, Dr. Tayaba emphasized the importance of persistence in order to be successful throughout medical school. She also discussed how it is important to see the career as a way to help people and make an impact on people's lives. Often, doctors are distracted by the financial aspect of their job and lose sight of what is truly important, helping improve the lives of their patients. Most of Dr. Tayaba's patients are children, but she sees some adults as well, treating mostly ADHD, anxiety, depression, and behavioral issues. She discussed how a fellowship in child psychiatry is very beneficial in order to have a better understanding of development and how childhood shapes who people become as adults. Issues during childhood are often the root of adult psychiatric conditions. So going through child psychiatry training not only helps understand and diagnose children, but it also develops your understanding of the reason people have mental illnesses as adults. There were several things that were consistent across all of my interviews. First of all, a psychiatrist's schedule can be very flexible, especially in private practice. It all depends on what kind of position they have and how much they want to work. Some work very busy, long days, 5 days a week, while others work less rigid 4-day weeks. Also, there is a great need for psychiatrists. There are simply not enough doctors to meet all of the needs of all of the people who would benefit from psychiatric care. Once someone decides to seek psychiatric care and finds a physician who is accepting of patients, they are often put on a waiting list that can last up to several months. It is also fairly difficult to find a psychiatrist who accepts insurance, making mental health care nearly inaccessible to people of lower socioeconomic status. Everyone that I interviewed had unique reasons for wanting to enter the field, but something that they all said was that they enjoy helping people and developing relationships with their patients. Of course, not every story has a happy ending, but getting to watch people improve and grow makes the job worth it. Psychiatrists usually meet with patients in half-hour appointments, which allows them to truly know their patients. They learn about every aspect of their patients' lives and use that information to help them recover and grow. A doctor that I interviewed on Monday, Dr. Brenner, described it to be a privilege to get to be someone's psychiatrist, as you are able to develop such a deep understanding of their lives. Dr. Brenner is a psychiatrist at UT Southwestern with a clinical expertise in psychotherapy. His time is split between meeting with patients, teaching and running the residency program, and doing scholarly work, such as writing and editing a journal. Something that we discussed that stood out to me was the focused and specific nature of psychotherapy in comparison to the non-specific nature of medications. For example, when you take Motrin to reduce inflammation in your elbow, you are reducing inflammation throughout your entire body, and the same concept applies to psychiatric medications. Instead of targeting one center of the brain, they impact chemicals throughout the brain. Dr. Brenner predicts that with new research, this will change, and we will be able to create more focused medications that target specific areas of the brain. In contrast, when a psychiatrist or therapist conducts psychotherapy, they are able to target specific parts of the brain, making it a very effective method of treatment. I also interviewed Dr. Taminga, a psychiatrist and professor at UT Southwestern. Her time is split between conducting research and serving as a psychiatric chair. It was very interesting to learn about her research, which is primarily in psychosis, specifically schizophrenia. Her main purpose is to identify the molecular causes of mental illness. She does this through various kinds of experiments, such as examining postmortem brain tissue, clinical trials, and animal model experiments. We also discussed the differences between psychiatry and neurology. Before fairly recent discoveries, it was believed that both neurological and psychiatric conditions manifested without physical causes, but we are now aware that they both have physical causes stemming from the brain. Even though the organ of focus is the same, the conditions treated vary greatly. Neurology deals with motor functions and things like seizure disorders, while psychiatry deals with disorders involving mood, personality, behavior, and emotion. Through interviewing Dr. Hutto and Dr. Holliner, both adult psychiatrists, I was able to learn more about what illnesses a general psychiatrist treats. Both of them most commonly see patients who suffer from anxiety, depression, and adjustment disorders. Most adult psychiatrists make referrals when regular therapy is needed, but they still are able to conduct therapy and follow-up appointments. Dr. Hutto conducts some therapy, while Dr. Holliner chooses to focus on the biological aspect of psychiatric illnesses. I was also able to interview an addiction psychiatrist, Dr. De La Cruz of UT Southwestern. She has both her MD and PhD and also completed a fellowship in addiction psychiatry. She spends about 80% of her time conducting research and the other 20% of her time meeting with patients. One of my biggest takeaways from my interview with Dr. De La Cruz was that some people are more likely to develop addictions than others. She talks about how the way some people's brains are wired simply makes them more prone to developing an addiction. Additionally, people who smoke or drink as adolescents are more likely to become addicts later on in life. We're unaware if this is because underage drinking and smoking alters brain chemistry, or if people who are willing to try these gateway drugs are simply more likely to try other drugs and develop an addiction. Dr. De La Cruz conducts research in the form of clinical trials over the use of medication to treat addiction, as well as over people who are more likely to develop addictions than others. Right now, she is researching chronic pain patients who become addicted to the opioids that are prescribed to them. Her focus is to try to understand who is more likely to develop these addictions. Being able to conduct focused research and interviews has been an extremely rewarding and exciting process, so I look forward to the rest of this year in ISM as I continue to expand my knowledge on the world of psychiatry.